Welcome and good afternoon everyone. Welcome to today's meeting of the Health and Wellbeing Board at the London Borough of Hillingdon. This meeting is being broadcast on the Council's YouTube channel, Hillingdon London. My name's Councillor Jane Palmer and I am co-chair of the board. Before we start, if you don't mind, I'll just go through some important housekeeping for everyone present. Please ensure that any mobile phones around you are on silent. We're not expecting a fire drill, so if the fire alarm does go off, please follow officers out of the building. And if I could remind people, please, to keep your microphone muted when you're not speaking and then unmute to speak. We're going to move on to the agenda, so let's start, please, with apologies for absence. Nikki?
Chair, we've had apologies for absence from Tony Lamon, from Lynn Hill, and Lisa Taylor is here as her substitute, from Eddie Yarn and Amanda Kerry McDermott's here as his substitute, and from Vanessa Odlin, Claire Eves is here as her substitute.
Lovely, thanks very much. Declarations of interest, are there any in the, before us that we haven't declared before? I'll take that as a no. Minutes of the meeting of the 5th of March. Does anyone have any comments, please, on the accuracy of the minutes? If not, I pause. If not, are they agreed?
Agreed.
Thank you. Just to confirm that items 5 to 9 will be in public and items 10 to 14 will be in private. So that's when the cameras go off and we deal with that in private. So, agenda item 5 is the North West London ICB Joint Forward Plan and the Mental Health Strategy, and I welcome Toby Lambert from London North West ICB.
Okay, so thank you, Chair. Just a point of clarification, we've got the Joint Forward Plan today and so not the Mental Health Strategy. I'm more than happy to bring the Mental Health Strategy as well, but two quite sizable ICB documents in one meeting, so it may have been a sort of possibly a sort of too much of a joy for all of you. So let me talk about the sort of the Joint Forward Plan. So the Joint Forward Plan sort of builds upon. So I'll go back here. So it's Joint Forward Plan. It is joint in a different sense to Joint Strategic Needs Assessment or Joint Health and Wellbeing Strategy, and that those latter two mean joint between NHS and local authorities, and the statute is quite clear that the Joint Forward Plan is joint between the ICB and so other NHS organisations. So it is hence an NHS document. I think it's important to sort of say that up front, as expectations may be slightly different given the use of the word joint. It does, though, build very much upon the Health and Care, North West London's Health and Care Strategy, which we published last November, and that Health and Care Strategy was joint in the Health and Wellbeing and Joint Strategic Needs Assessment sense, as it was prepared by the Integrated Care Partnership, upon which sit all of the 8 local authorities in North West London, as well as members of the Integrated Care Board. I'm not going to attempt to go through the rather lengthy Joint Forward Plan itself here today. It's got 9 themes in it, and the paper draws those out. What I am going to do, though, is do a bit of colour about the cross-cutting principles behind those 9 themes. Because in essence, what the Joint Forward Plan lays out across those themes is 3 steps, and those 3 steps are first ensuring that we have what we call a common offer across North West London. So for various historical reasons, our 8 predecessor clinical commissioning groups had made different commissioning decisions about what was important for their local populations, but that has meant that we have a inequity in availability of service across North West London. So there's one borough, for example, that doesn't have a straight rehab service, Some boroughs, if you look at the MSK service, have had pain management as part of the service, others haven't. Others have had rheumatology as part of the service, others have. I could go on with sort of multiple examples, but that strikes us as quite an inequitable sort of starting point. So the first thing we're laying out across the different areas in this joint forward plan is that we should have a core sort of common offer which is available to all residents of North West London, no matter sort of where they might reside. So that's easy to say, but in order to do that, and in particular to make that a levelling up of service availability rather than a sort of levelling to the middle, we therefore need to sort of push in the absence of a spare pot of extra money turning up from somewhere, which would be nice to believe. We await the Chancellor's sort of autumn statement with interest, but I don't think we can rely upon it, given the announcement yesterday. We therefore have to push the productivity of our services so far as we can. So it's only by pushing that productivity we're going to be able to liberate the money to sort of level up. The analysis we've done across our services to date suggests that there is scope to do that, but that is a rolling programme running around all of the services which sit within that sort of core or common offer. So that's the first thing that the joint forward plan lays out. And the second is that we know that really having a sort of core or common offer, while that will address some of the inequity in service provision, is not going to address the inequity in access, experience or in outcomes. So the second thing is to then work or continue to work alongside our sort of local authority colleagues on how we sort of can address hesitancy, sort of build trust, reach out to the sort of the seldom heard sort of communities across North West London to encourage those of them who tend to present late or sometimes sort of present not at all to come forward. And that should, if we manage to do that right, sort of then lead to a change in our sort of resource allocation across North West London, as those areas which are presenting more, hopefully those who are in the greatest need, will therefore need a higher level of service in order to sort of meet their needs as they present. So there is a cunning bit of choreography to try and get the resource to shift at about the same pace as the sort of the need is coming forward. Because if we go too slowly, then we will discourage those who have now come forward, because their experience will be they'll come forward and they still can't access service. But if we go too fast, we will end up with sort of areas of underutilised service, because we'll put the resource in and people won't be turning up. And that's not the sort of the best value for money in a constrained sort of resource environment across sort of North West London. So that's the second thing which sort of the plan lays out. The third is that sort of no matter how well we do on tailoring our offer and addressing sort of that hesitancy, there are certain communities across North West London for whom that offer will never be sufficient. So the textbook examples, things like sort of rough sleeping populations, so refugees and asylum seekers might be another one which is particularly sort of topical for sort of North West London, and those are going to need a bespoke offer. But we're trying to do this very much in a how much of people's needs can we meet through the core offer and by tailoring the core offer, and then where do we need to depart from the core offer, rather than sort of saying we've got myriad different populations in communities in North West London, let's develop a different offer for each one of those. If we go down that sort of latter route, we will end up with sort of myriads of sort of different contracts, different service offers, and we will add to confusion. And part of what we are trying to do is to simplify and sort of make it easier to understand. So those are the three sort of cross-cutting themes across each of those sort of 9 priorities laid out in the joint forward plan. The next point I want to make is that this is a joint forward plan talking about sort of North West London sort of as a whole. As I said, we did start from the Joint Strategic Needs Assessment, the Joint Health and Wellbeing Strategies, and what we have observed is that there is actually a great degree of commonality between what each of our boroughs have laid out in those Joint Health and Wellbeing Strategies. And it's quite often expressed differently, so some say sort of start well, live well, age well, some say mental health, frailty, so. But the actual sort of core of what people are trying to do is very similar. In fact, it's about sort of an 80 sort of 90% match. So that North West London sort of view does help us to sort of deliver more across sort of deliver more by doing things at scale where we can, and allowing sort of boroughs to tailor sort of where necessary. Indeed, probably at an even lower level than boroughs, given populations vary quite a lot sort of within the individual boroughs. There's then a sort of remaining sort of 10 to 20% of sort of aims laid out in those joint health and wellbeing strategies, which do diverge from borough to borough, and we've tried to be quite sort of thoughtful in ensuring there is sufficient space to sort of allow for sort of those local priorities as well. Now, the statutory role in the sort of Health and Wellbeing Board in this is technically to send us a letter saying whether the joint forward plan adequately meets the needs of the residents of Hillingdon as laid out in the Joint Strategic Needs Assessment. We did receive sort of from Kelly a very helpful sort of letter on behalf of the Health and Wellbeing Board, giving us a sort of number of sort of points of feedback, so almost all of which have been incorporated into the document you have with you today. It's not quite the same as sort of the letter. We were unfortunately slightly hampered this year by the appearance of sort of two sets of PERDA at the critical moments, and an instruction from NHS England that we weren't allowed to talk about the joint forward plan in public during either of those sets of PERDA. Given that the deadline from NHS England for completion of this, they handily moved to July the 5th. I did contemplate trying to get every Health and Wellbeing Board to meet in the hours after the count and on that Friday morning, but thought that was probably not a very sensible idea to even suggest. So we have sort of missed that deadline. So part of what I want to talk about today is how we can do this better sort of next year. And the paper you have sort of lays out a number of ways in sort of which we could do that. We could sort of lay out a shared sort of needs assessment more clearly and use that to drive sort of what's in that sort of joint forward plan. We could do some clearer sort of prioritisation. Those 9 priorities cover pretty much anything you could think of in terms of sort of health. Probably don't cover everything you could think of in terms of sort of the broader agenda. And most of the prioritisation has happened one level down in the sequencing, but we could go further on sort of that prioritisation. We did invite sort of local authority colleagues to the town hall meeting, which we ran as part of the process, but that may not be the most appropriate or helpful way to involve local authority colleagues in the development of the plan. So I am sort of very much sort of all ears for your suggestions on how we can do this better sort of next year. In particular, I want to try and pull it forward so we have a reasonable draft by the end of December, because that will then allow us to have some meaningful conversations over January, February, March, i.e. before the beginning of the financial year, rather than sort of this point in July, which is frankly a bit late for any sort of plan setting for the balance of this year. So that's in essence what you've got. So this joint forward plan, can't make many changes to it at this point, but I think I've laid out some of what's in there, and I am very open to suggestions on how we can improve it sort of going forward.
Thank you very much. Would you mind just turning your mic off, Toby? Thank you. Thank you very much, Toby, for the introduction of that. Just to say that we did meet the deadline, but as Toby illustrated, we did submit on time, but as we're all aware, there were elections and things like that. So now I'm interested in comments and suggestions for improving the process for the next joint forward plan. Does anybody want to start with a discussion? Kelly, let's go for it.
Thank you, Chair, and thank you, Toby. 2 things. One, to say thank you for taking on board our comments and sort of them being reflected in the plan. And I know that you want a very tight timeline in terms of the expectations from NHS England about the date of publication. So I'm really grateful that you allowed us to actually contribute to that. I suppose one of the key things that I think I'd like in the forward plan is to think about how do we raise the levels of all 8 boroughs to the levels of the best. And for example, in Hillingdon, we support care, informal carers particularly well, and end of life, people dying in their preferred environment in which they'd like to die. And I think that there are opportunities for us as well to reflect on areas that we are weaker on. And actually, it'd be really, really good to benchmark us all in a learning and development way in order to help us improve, in order for us all to raise our standards, at least to the level of the best, and then to start thinking about actually how do we widen that across, being the best in London, etc., and wider. I think that would be I'm not advocating setting targets, but using this as a kind of a learning and development opportunity so that we can understand who is working in that space and what is that achieving, and whether some of that learning can be localised to the populations that we serve.
Thank you. Any other comments?
So this is an old chestnut that I bang on about a lot, but when we compare boroughs with boroughs, we seldom acknowledge the fact that the data that we use is not accurate, particularly when it comes to population numbers and registered patients with GPs. So we know that the inner London GP registered population is inflated, often by 50%, and this means the funding that goes to these boroughs is higher than it is to, say, Hillingdon. And until and unless that is acknowledged and addressed, we're always going to have an uphill battle. So I'd like to see something strategy to say, right, we're going to address this disparity, because we're always talking about inequalities of access, and surely one of the biggest inequalities of access is inequality of access to the funding, which is due to the way that the funding is distributed.
Any other Richard? Okay. Any other comments? Resounding silence means no. Okay, so thank you very much, Toby, for the presentation, and hope you've made note. I've seen you making notes, so that's confident. So the recommendations are before us on page 1. I propose that the discussion be noted, and I think I need a seconder for that. Do I have one of those?
I'm happy to second.
Okay, lovely. So everybody in favour of that? Okay, that's lovely. That's unanimous. Thank you very much indeed. Moving on to agenda item 6, which is the local health and wellbeing strategy itself. Year 2 interim update. Kelly.
Lovely, thank you, Chair. So just as a little bit of context, we're now this report provides a kind of a mid-3-year update on our progress against the priorities that we've outlined in our health and wellbeing strategy. And I think important to mention as well that this was actually an area that was flagged as part of our adult social care CQC inspection about whether we do evaluate it. And I'm aware that the last evaluation of year 1 landed in quite a negative way, so I was asked to go back and re-look at the context in which the strategy was measured and the metrics by which we've evaluated our progress. And I've done that, and I would hasten to add that there are still some measures, and it goes back to sort of our earlier conversation about how do we benchmark ourselves against some of these areas? Do we benchmark ourselves against our performance between our previous performance and our current performance, which demonstrates progress? Do we measure ourselves against where we are in relation to North West London, London and England? And for some of these kind of local measures, some of our priorities are reflecting an ability to demonstrate that we've implemented strategies which are clear improvements to our current service provision. So that's essentially what I've tried to do. It's work in progress. It's not quite there yet. And I've also tried to make it more short and concise, although you will see that there is some of those areas have quite a lot of detail in terms of measures, in terms of a narrative that supports the data that people have submitted. And I would say that as we go forward, having this baseline and asking people what their next steps are should lead to a report that's even more concise in terms of did people deliver what they said the next steps were, and then forward planning prospectively what are the next steps for the next reporting period. So I plan to deliver the year 2 sort of strategy review at the next Health and Wellbeing Board, which kind of is a 6-month post the end of the year, and gives us a little bit of a forward plan in terms of what would our plans be for developing our new strategy, which expires at the end of next year. So just in that context, I'm pleased to, as a starting point, I'm pleased to report, and thank you to members of the board, is that everyone did submit data. And I know that was a bit of a challenge that we had before, and while some of the data is a little bit is that what we really want to measure, I am really pleased to say that people were very delivered on time and delivered what was asked for. So, as I said, this is a mid sort of a year and a half into the strategy. The areas give a kind of metrics, and they're also RAG rated, and as I've said, they're RAG rated based on national data and local data, and I still haven't quite worked out, and that will be for the end of year 2 report, the best approach to that. So some of that RAG rating is a little bit subjective, and some of it's a little bit more objective based on national data. So there are 17 priorities. 5 are RAG rated red, 8 are RAG rated amber, and 4 are RAG rated green. The red areas will be probably no surprise, children's oral health, and there is a really clear narrative in there as to North West London has the poorest children's oral health of all of London. We do have the best oral health in North West London, but in many respects we are sort of similar populations to the rest of North West London. So we are demonstrating improvement against that, but we are not at the level of London, and we're not at the level of England, albeit that quite significant work, and Councillor Palmer, you'll be aware of the Integrated Care Partnership priority of children's oral health, and significant amount of work has gone on between Directors of Public Health, local authority leads for oral health, children's oral health, and the ICB, Nicola Kay and Hilary Tovey and sort of Julie Sands in that area. Still work in progress, and certainly there is some funding that is coming our way from the ICB around the implementation of the new dental strategy and forward plan, recovery plan. That's coming to oral health promotion, which is an opportunity to really advance on the level of 8 boroughs, but we will certainly as a borough benefit from that. On top of that, I will also say that we have got NHS England funding to support a new contract for children's oral health, and the value of that contract will double next year. So we're working on what works this year in order to have then a 2-year contract of quite a significant investment in that area. Reducing homelessness is an area that has come up red. The local authority are familiar, will be fully aware of the challenges of homelessness in the borough. It's a perennial problem in the whole of London, so that's not new. The area that I'm working on is, and I have RAGRATE, is one of my areas, which is a public health review of disparities, and the challenge for me is that the timing of the JSNA, which is planned for next year, and the new population health management team are all adding that kind of specialist capacity in order to help us do that. But what I would say is, while we haven't done a comprehensive review of disparities, inequalities in the borough, what we have done is work that is business-led in order to tackle key pieces of work. So that's still outstanding. The whole systems approach work in Hayes, I've ragged that red, but what I would say is it's ragged against the fact that it's not demonstrating outcomes based on published data yet. But what I would say is that if I were to rate the process of delivering that piece of work, it would probably come up as amber. So the work is continuing. It's probably been slightly delayed, but it certainly as a systematic way of working, it is actually achieving more than the published data would suggest. The fourth area is the implementation of the autism strategy. The strategy remains in draft. We're yet to agree some key performance indicators, but that's on Gary and my radar. So that in terms of moving that forward, we've very much identified some key actions that need to be taken. And so they are the key areas that I would say. They're the 5. The amber ones you'll see in the report, the green ones are also in the report. And at the end of the report is, from page 26 onwards, I've provided sort of an update on where we are with population health management. The board will be aware of population health management being our framework of choice in order to tackle some of those disparities that we have seen in the borough. It links very nicely as well to the development of integrated neighbourhood teams, and actually this new population health management team that's come in, we've got 3 out of the 4 posts recruited to are currently working on sort of data frameworks and developing an education modules in order to build capacity and capability across the system. So that team will be with us for 2 years. It would be great for them to be able to demonstrate significant impact. So moving forward, we suddenly think, well, actually, it's important that we keep that. We have that sort of ability, but actually it would be great to maintain that team in the future. And this has been afforded to us, as I say, by that NHS England inequalities funding. And then I think just the last bit, the last part I'd just like to flag up is that actually that sort of ability to tackle inequalities through the integrated neighbourhood teams has been a really good join up in terms of ensuring that the population health management capacity and capability that's new into our HHCP is actually the enabling mechanism that allows our integrated neighbourhood teams to tackle a place-based approach to some of the really complex health issues that has been quite intractable in the past, particularly around the priorities that we've set for ourselves as part of the neighbourhood teams, which is hypertension, obesity, low-level mental health and anxiety, and then which also then allows the integrated neighbourhood teams to then also focus on areas of health need that are relevant to their own particular PCN. So whilst we've got a long way to go in terms of our health and wellbeing strategy, what I hope this paper does demonstrate is that we've got a current status of where we are. We've got another year and a half to deliver improvement in many of these areas and turn a few more green. And at the next meeting, I will present the second year and then be able to be a bit more concise by demonstrating that the next steps that have been put into the plan have been achieved, and there is a prospective plan for improving some of those priority areas in terms of some of the action planning that goes with it. I think I'll leave it there, Chair.
Thank you, Kelly. It does indeed tell us exactly where we are, and it's very useful. I think it's probably one of the first times I've seen something that is exactly that. So for me, it's important that we see where we are and where we need to go, and now we've got something on paper that helps us get there. So thank you very much for the report and for the detailed explanation. Are there any comments, questions for Kelly? Yes, Keith, go. Yeah, I mean, I'd just like to echo that, Keith. Thank you to the partners that actually submitted the data on time. That in itself is a feat to do that with the work that everyone's got. So I want to echo Keith and Kelly's thanks for that, and it is a tribute to our partnership working, to be fair, that no matter what we're doing in our day job, that when one of us asks for something to be done, it's delivered. So thank you very much to everyone for that. Are there any other comments on that report? Professor Goodman?
Yep. To add on to that, just put a bit of context onto one of the medical aspects, which is the hypertension one, which I don't think people realise how important that is. It is probably the single most important contributor to a premature death. And when I was at medical school, and probably still up until very recently, we used to have a rule of halves, which was half of the patients with high blood pressure haven't been diagnosed, half of those who have been diagnosed haven't started treatment, and half of those who are on treatment aren't treated to the target. And looking at these figures, we've done fantastically well to improve those patients who, we didn't know had hypertension. Those who weren't being treated effectively are now being treated more effectively. Now, we won't have instant results because high blood pressure takes its toll several years down the road, but it will reduce the number of strokes, number of heart attacks, and certainly the number of patients who end up on dialysis. So this is some really good work that's been done in the borough.
Councillor O'Brien.
Thank you very much. Again, I welcome the report, and it's nice to see how, as we're starting to move into year 2, very positive that we have got funding for young children and oral health. The funding is coming through, but I just want to stress, as normal, how do we get that working within the educational settings, making sure that people are on board, and can that be, obviously it's dovetailed in the reasoning as to why we have childhood obesity, but if we've got that funding, we just need to make sure that it works with the obesity schedule that we're running, as well as oral health. But yeah, it's great to see that it's been recognised and we've been given some additional funding, and hopefully nothing will be left in cabinets and cupboards and left to sit there forever. Thank you.
Thank you, Councillor O'Brien. One of the things that the ICP work, that the Integrated Care Partnership work in North West London, which I'm the lead DPH for, is using the mechanisms of school-based health in order to drive that oral health. Obviously our focus has been on that early years agenda, and it's really important that we get that prevention work done, but actually that focus on primary school and linking, as Councillor Palmer said, sort of linking all of that sort of childhood obesity, infant feeding, sugar levies, school-based water-only policies, etc., in terms of delivering a whole systems approach, is where that work is really driving. And that is bringing together the NHS, the ICB colleagues, and is also bringing together local authority colleagues. But there is a little bit of thing that I will play out, is that we as big institutions and big statutory organisations do need to role model some of that ourselves. So getting schools engaged in water only and reducing sugar content in food provided in schools. Hospitals, for example, providing sort of sugar-free options, and particularly in paediatric wards, etc. These are kind of areas where we need to be promoting that really clear message, and yet I think there's probably a gap between where we should be and where we are now and where we should be.
Any other comments on the report? In which case the recommendations are clearly outlined on page 7, so I would be moving those recommendations as stated in the report, and I think I need a seconder again for that. Yep, Professor Goodman. And so are we all in favour of that? Fabulous. It's all going very well, isn't it? Okay, so that brings that item to a close. You're too tired to raise your hand, Kelly. Oh, it's a shame. Perhaps you could ask Julie to give you a little. Okay, so that brings us on to agenda item 7, which is the Better Care Fund.
Thank you, Chair. The board is actually being asked to ratify the decision of the co-chairs to approve the 24-25 BCF plan. To give a bit of an explanation to the board, the intention was that the plan would come to the scheduled board meeting on the 11th of June. Of course, that other events got in the way, which meant that it was not possible to have that meeting. So the request to the co-chairs was really a pragmatic way of ensuring that we were able to get a decision on the plan to meet national requirements, so that the governance process could be completed at the earliest opportunity, so that we weren't dragging this whole process out later into the year. Just to highlight a few points about the plan. Largely a roll forward from 23-24. the value increases from 96 million in 23-24 to 100 million in 24-25, which is the net effect of the national uplifts and the removal of some services funded from the NHS additional contribution, which were subject to a separate review and linked to the broader BCF review, which is a subject on the board agenda for later today. Just to reiterate the point made to the co-chairs is that Hillingdon is compliant with all of the national conditions. I've been informed informally that we are being recommended for assured status, which is the case for all plans, certainly in North West London, and expecting written confirmation of that some point within the next couple of weeks. So other issues, particular issues, I think, really around developing the submission this time round was around some of the national metrics. Just again to reassure the board, as in previous years, the view has been taken that targets set should actually be achievable. There's been a particular issue this year with some of the data for some of the NHS metrics, which has been a bit of a national issue and has particularly affected some boroughs within North West London. Some of the reliability issues. Some of the data was actually showing activity being far lower than was realistic. So we've therefore worked with North West London colleagues with support from for NHS England's Better Care support team to do a workaround, and that has led to the targets that are reflected in the submission documents. I think the additional funding for this year, for 24-25, comes in the form of an additional 1.3 million ICB discharge funding to the Hillingdon Health and Wellbeing Board. There was consultation undertaken by the ICB earlier in the year around the effectiveness of the discharge schemes in 23-24. And this has led to about 392,000 of that money being allocated to a range of schemes shown in Appendix 1 of the report on a fair share basis. That leaves approximately 934,000, which will be coming directly to Hillingdon, which is specifically intended for use in addressing capacity on the discharge pathway 3, and also with a view to diverting people onto to other pathways. So there's a number of schemes that are currently under development, in discussion with partners, with the aim of them becoming operational by sort of September, October of this year to support the system going into the winter period. I'll leave it at that point, Chair, and happy to take any questions that you or the board may have.
As I always do, Gary, I thank you very much for your diligence and professionalism with this battle of the report to the Better Care Fund plan. It's always a very, very good piece of hard work. Are there any comments or questions for Gary? Professor Goodman?
Yeah, just one query about the extra beds in the Furness ward. It's quite away from the residents' Hillingdon travel. It'll take about over an hour with the best will in the world to get there. It's not an easy place to get to from Hillingdon. Were there any other sort of places that they could have be placed that were more convenient for them?
I think Furness was the one that was actually identified as the most suitable for Hillingdon. We also have access to Clay Pond, but I think that's actually even further away.
We don't look outside of the places that are
I mean, this is based on the discussions with the ICB. So in terms of actually looking outside of the Shires, or outside of the confines of Greater London, I'm not in a position to answer that question.
Would it be too cynical of you to suggest that because it comes from the ICB is purely London focused, and for an outer borough like ourselves, we're not making the best use of our neighbouring boroughs in terms of basic residents?
I think Keith can probably comment on that. Richard?
Thank you. Just to echo your comments, Chair, I would really like to thank Gary for everything that he has done in working with our team and with the ICB team in preparing a first-class report and, even more importantly, a first-class BCF plan for submission. And we really trust that it will be assured in the way. But it was a fantastic piece of work, Gary, so thank you. I wanted also just to note, I mean, I think each year we manage to make the BCF process more complicated, and I see that in Para 16 you're mentioning about the issue of data accuracy against the national metrics, and that we are one of 5 boroughs in North West London where that is an issue, which means that in only 3 boroughs there is not an issue with data. And I wondered if there was anything more that you wanted to share with the committee about why that was, or what we could be doing to ensure that Hillingdon's performance was accurately reflected against the national data.
Thanks, Richard. First of all, Chair, I'd actually like to say this is very much a team effort pulling all of this together.
I know, but you sit.
And you'll notice I made no comment about the increased complexity of this year. Oh dear. Oh well. I think part of the problem around the accuracy of the data is some of the information that's been fed through to through national, coming through some of the through the trusts, the acute trusts, and I think that may actually be linked to implementation of new IT systems. But I understand this isn't an issue that's peculiar to London. I understand that there are problems elsewhere in the country as well. But it was hoped that once introducing new IT systems is always horrendously complicated and takes time to bed in. But once they get bedded in, then hopefully things will improve.
Any other comments? Okay, so it would be, as per the recommendations, would be requesting that the board ratifies the co-chair's decision to approve the draft NHS Better Care Fund.
Agreed.
And note the comments on the content of the report. So I think, again, I need a seconder for that. Councillor O'Brien. Everybody in favour of that? Nodding happily and smiling. Oh, and with a hand up, Kelly. Thank you. That's that one then. So that brings us on to the next agenda item. Is that 9? I seem to have missed out. Is it? I know. I have it as agenda. I have it. Oh yes, agenda item B. Sorry, agenda item 8. Agenda B is the Integrated Health and Care Performance Report.
Thank you, Chair. Two main aspects to this, starting off with, again, seeking the Board's approval to ratify the 23-24 end-of-year template that we were required to submit, again, with the intention of taking this... Sorry, it was required to submit in May with the as a draft, intending to take to the Board on the 11th of June. The sort of highlighting some of the key points, I think, particularly around the some of the metrics, again, some of the issues with the data on some of these. Also, another area of, I think, to highlight for 23-24 is around some of the financial underspend on the disabled facilities grant, and to assure the Board that we're actually in the process of changing policy to actually increase flexibility to enable that to be spent in this year. The Board will be able to see that some of the mixture of performance on some of the other metrics within the report. Unfortunately, it has proved quite challenging this time to actually provide information to give updates on where the on action being taken, where the performance against some of these metrics isn't where we would actually want it to be. I'll leave it there, Chair, and happy to take any comments, questions that the Board may have.
Do you want to address us on why you use the word challenge?
Is actually being able to get sort of updates across partner organisations within the time available, and I think some of that, Chair, was because of the collection of lots of different things actually occurring all at the same time.
Okay, I'm just trying to work out what needs to be done about that. I mean,
I think it's actually about starting the preparation for completing the performance report earlier, Chair.
Why didn't I say that? Why didn't I think of that? Comments? Keith, please. Thank you. That's helpful because, as was mentioned at the start, you know, when I meet with my other London boroughs, it is about bringing us all up to the same high standard, and if we're already up there, it seems a shame that we're perhaps not showcasing that as well as we could do. So they're probably sick of hearing my voice about how good we are, but if we've actually got some more fleshed out reports, then that'd be helpful. So thank you, Keith, for that. Are there any other comments on the agenda B? Go on. Yeah, I certainly didn't wish to think that we're already there. We're certainly not. I mean, there's lots of other boroughs doing things that we could do better ourselves. So, yeah, thanks for that gentle reminder. Okay, in which case, again, I'm asking for the ratification that we approve the draft Better Care Fund, and on behalf of the board, and we note the comments on the report, and again I'll need a seconder for that. Kelly, do you want to put your hand up? Thank you so much. Everyone in favour of that?
Great.
Marvellous. Okay, so that takes us on to agenda item 9, which is the board planner and the future agenda. That is for noting. Do we need a seconder for that, or can we just accept it? So we all accept that, hopefully, which will bring me to the end of the public part of the meeting. So thank you to those members of the public watching on YouTube, and for members of the public in the back there. Will everyone please remain silent until the Democratic Services have confirmed that the live broadcast has ended and the loop has been switched off. Thank you.